What if the pill meant to calm your mind is quietly changing it? Millions of people take alprazolam every single day. You probably know it by its brand name, Xanax. Doctors prescribe it for anxiety, for panic attacks, for that feeling when your chest tightens and your thoughts won't stop racing. And it works. Fast. But here is what most people are never told. This drug, the most commonly prescribed psychiatric medication in the entire United States, comes with side effects that go far deeper than drowsiness. Today, we are going to talk about 7 of them. Specifically, what this pill does to your brain, and trust me, number 4 will genuinely surprise you. Before we get into the side effects, you need to understand one thing. How does this drug actually work? Alprazolam belongs to a family of drugs called benzodiazepines. That is a big word, but the idea behind it is simple. Your brain is constantly buzzing, thoughts firing, signals flying. When you have anxiety, that buzz becomes a storm. Alprazolam steps in and turns the volume down. It boosts a chemical in your brain called GABA. Think of GABA as your brain's natural brake pedal. Alprazolam presses that pedal hard. The result? The storm quiets. Your body relaxes. The panic fades. That is exactly the point. But here is the problem. Your brain is not just a machine you can slow down and speed back up without consequences. When you press that brake pedal again and again, day after day, things start to change. And those changes, that is what we're here to talk about. Side effect 1. Extreme drowsiness and slowed thinking. Let's start with the one most people already know about. But knowing about it and truly understanding it, those are 2 very different things. Alprazolam makes you drowsy. That is not a surprise. But here is what is surprising. In studies of people taking this drug for panic disorder, roughly 3 out of 4 reported drowsiness. That is not a rare side effect. That is almost everyone, and it goes beyond just feeling sleepy. This drug physically slows down how your brain processes information. Your thinking becomes sluggish, your reactions slow down, your motor skills take a hit. Now, imagine driving like that, or making an important decision at work, or trying to have a serious conversation with someone you love. And if you mix alprazolam with alcohol or opioids, doctors warn that the effect becomes dangerously worse. Your brain does not just slow down, it nearly stops. Then this is not just uncomfortable, for many people, it is life-altering. Side effect 2. Memory loss. Anterograde amnesia. Now we get into something that genuinely shocks most people when they first hear it. Alprazolam can steal your memories. Not the old ones, the new ones. There is a specific type of memory loss called anterograde amnesia. It means you cannot properly form new memories while the drug is active in your system. You could have a full conversation with your friend, go to dinner, watch a movie, and the next morning, it is just gone, like it never happened. Doctors compare it to the way people forget their dreams after waking up. The experience happened, but your brain never saved it. Research confirms this is not random. Alprazolam specifically targets the part of your brain responsible for encoding episodic memories. And those are your personal memories, the moments that make up your story, your life. And this drug quietly erases them while you are still living them. Side effect 3. Cognitive decline, brain fog. Side effect 2 was about forgetting moments. This one is about losing your sharpness, slowly, gradually, and sometimes permanently. Long-term alprazolam use does not just make you forget one conversation, it begins to wear down how your brain functions overall. Research published in Pharmacy Times found that long-term benzodiazepine use causes impairment across multiple areas: motor coordination, verbal reasoning, concentration, processing speed, and even IQ. These are not small changes. These are fundamental brain functions quietly deteriorating. Many people who take this drug for months or years describe the same experience. They call it benzo brain fog. Everything feels slower. Thinking feels harder. Words do not come as easily. Focus disappears. The frightening part is that most people do not connect it to the pill. They think they are just tired, just stressed, just getting older. But the research is clear. The drug is changing how their brain works. And in many cases, they do not even notice it happening. Side effect. 4. Physical dependence and withdrawal. And the brain trap. This is the one we promised would surprise you. And it does. Every single time. Here is what happens inside your brain on long-term alprazolam use. Your brain is smart. It notices that GABA, its natural calming chemical, is being boosted artificially by the drug. So it adapts. It starts reducing its own GABA receptors. It thinks, why keep so many if the pill is doing the work? Seen at the same time, it ramps up the systems that do the opposite. The ones that create excitement and anxiety. Now, here is the trap. When you try to stop the drug, your brain is left with too few calming receptors and too many anxious ones. The anxiety that comes back is not just your old anxiety returning. It is worse. Far worse. Research shows that alprazolam withdrawal is more severe than almost any other benzodiazepine because of its short half-life and high potency. Your brain was not just calmed by this drug. It was restructured by it. That is not dependence. That is a trap, built quietly, one dose at a time. Side effect. 5. Depression and suicidal thoughts. This one is deeply important, and it is one that does not get talked about enough. Alprazolam is prescribed to help people feel better, less anxious, more in control. But for some people, it does the exact opposite to their mental health. The Cleveland Clinic warns clearly that this medication may worsen depression and, in some cases, trigger thoughts of suicide. This can happen at any time, but it is especially common right after starting the drug or after a dose change. Think about that. A person already struggling with anxiety starts taking a pill for relief, and that pill, in some cases, pushes them deeper into darkness. Beyond suicidal thoughts, many users report persistent irritability, crushing fatigue, and an inability to concentrate. These symptoms quietly feed depression. They make everyday life feel heavier, harder, hopeless. This drug touches the deepest parts of your brain, and sometimes those parts do not respond the way anyone expected. Know if you or someone you know is experiencing these feelings. Please talk to a doctor immediately. Side effect. 6. Slurred speech and loss of coordination. By now, you understand that alprazolam slows the brain, but here is something most people never expect. It can change the way you speak and move. There is a condition called dysarthria. It means your brain is struggling to control the muscles used for speech. People on alprazolam can develop slurred speech. Their voice changes. They talk too slowly or rush through words without realizing it. And it is not just speech. The drug impairs your physical coordination too. Simple tasks become harder. Walking steadily, reaching for something, maintaining your balance. Research from American addiction centers confirms that impaired coordination is one of the most common effects of this drug. To add low blood pressure on top of that, and you have a person who is dizzy, unsteady, and speaking unclearly. To a stranger, this can look like intoxication. But it is not alcohol. It is a prescription pill, one that millions of people take every single day, often without any warning about this. Side effect 7. Possible long-term dementia. Risk. We have saved the most alarming one for last, and we want to be honest with you. The science here is still evolving. Researchers are still debating. But what they have found so far is deeply concerning. Long-term alprazolam use has been linked to a significantly increased risk of dementia. Not memory fog, not brain fog. Actual, irreversible dementia. The Sterling Institute states clearly, while short-term use may impair memory in ways that can recover, long-term use raises the risk of permanent cognitive damage. And one major study found something that stopped researchers in their tracks. Long-term benzodiazepine users had up to a 78% higher risk of developing dementia compared to people who never used them. 78%. Now, correlation is not always causation. Scientists are careful to say more research is needed. But when a number like 78% appears in peer-reviewed research, it deserves your full attention. This is not meant to frighten you. It is meant to inform you. Because information is the one thing no pill can ever take away. Now, before you close this video, we need to say something important. This video is not against medicine. It is not against doctors. And it is absolutely not saying that alprazolam is evil. This drug has helped millions of real people. Them people with crippling panic attacks. People who could not leave their homes because of anxiety. For them, this medication was life-changing. In the right hands, at the right dose, for the right duration, it works. But here is the truth. A drug this powerful deserves your full attention. Not fear, attention. So what should you do? Talk to your doctor. Have an honest conversation. Ask questions. Know what you are taking and why. And if you are thinking about stopping, please, never stop suddenly. Stopping alprazolam abruptly can be dangerous. Medical guidelines are clear. The dose should come down slowly and carefully. No more than 0.5 milligrams every 3 days. And for some people, even slower than that. Your brain needs time to readjust. Give it that time. And finally, if this video gave you something, a fact you did not know, also a question worth asking, a conversation worth having, share it right now with someone who takes this medication, with a family member, with a friend. Because knowledge does not just inform people, knowledge protects them.